So, did you know that back in the day, opera houses used to allow their female singers to have days off when they had their period? They didn't need to sing. They didn't even schedule performances on those days. This practice was actually only stopped around the 20th century in Eastern European opera houses. So it begs the question, do our hormones play that much of an effect on our voice that we should refrain from singing altogether? What about now? Do people still do that? Maybe you've noticed your voice is just really difficult to work with on your period, or maybe it doesn't even bother you at all. So stay tuned, because we're going to learn about hormones, their effect on the voice, and should you sing whilst on your period? Is it safe? Hello lovely ones! My name is Livia. I'm a professional operatic soprano, voice teacher, and the founder of Singing for Self-Care. If you like heart-based singing and health, I highly suggest you subscribe, because I'm here for you every Monday with tips on your most powerful method of self-care, your voice! Because remember, you and your voice are practically magic. I've had this video on my to-do list for a while because it's actually a really interesting topic, but I wanted to hold off for a little bit because I knew that I would be seeing a lecture by Joanne Bozeman, who is an incredible vocal pedagogue and knows so much about this field. I'm going to link her book in the description of this video should you want to learn more. I want to add a little bit of a disclaimer just to the beginning of this video as well. I am going to try and avoid gendered words because not all women menstruate and not all people who menstruate are women. Now, having a period doesn't make you any more or less of a woman. Some people who identify as women have medical issues that might prevent them from menstruating. But I think it's really important when talking about this to be inclusive of trans and non-binary folk as well. So if you are a singer and someone who menstruates, you may have noticed at that time of the month, your voice is doing some funky stuff. You may notice that accessing your high notes is a little bit harder than usual. You may develop a bit of a husky quality to your voice, a bit of difficulty getting like focus to the sound. It may feel kind of like breathy, it may feel a little bit hoarse. So just like other PMS symptoms, some people don't actually experience these symptoms really much at all. But if you have experienced these symptoms, don't worry, it's not all in your head. Scholars started researching the effects of hormones on people's voices as early as kind of the mid-20th century. And by the 80s or so, there was a pretty clear link between hormonal changes and the quality of the voice. Or I should say changes of the voice. Your voice always has an authentic quality. So in the 1980s, they discovered that the cells in the vocal folds or vocal cords acted in a very similar way. They would change in kind of a very similar pattern to the cells in the uterine cervix. In fact, they were so similar that it was actually really hard to tell the cells from the vocal folds to the uterine cervix apart. So most people who menstruate have on average a 28-day cycle, and the groups of hormones that make up estrogens and progesterone are linked with fertility. So these hormones over the course of 28 days move in quite a predictable cycle. These shifts in hormones that are quite predictable have an effect on our whole body, but also our voice as well. So it's thought that around the middle of your cycle, day 14, around ovulation or just before ovulation, when estrogen is at its peak, that's actually the time that your voice is most cooperative. Around that time, it's going to be easier to do your vocal gymnastics, so you're going to have more elasticity to the voice. You're going to be able to sing coloratura easier, you're going to be able to sing your high notes easier. But of course, the converse side to that is when the hormones drop, your estrogens drop around your period time, things are going to get a little bit more difficult. So what can happen is when your estrogen drops, your progesterone can be a little bit more dominant in the kind of hormone mix than it usually is. So much like you oftentimes get swelling and bloating during the time of your period, the same thing happens to your vocal folds as well. Progesterone is going to encourage the little capillaries in your vocal folds to engorge a little bit more with blood. So that's going to make your vocal folds enlarge slightly. That is going to change the vibratory characteristics of the voice somewhat. Guess what progesterone also does? It makes your vocal folds slightly thicker, and it does also affect how much lubrication the vocal folds have as well. So they're going to be a little bit drier than normal as well. So if you think things are swollen, things are dry, things are feeling thick and not elastic, and you've got these tiny little muscles trying to vibrate together as you sing, it's going to make the whole experience of singing a little bit more effortful than usual. So what might you experience when you're on your period that could affect your voice? If you have issues with acid reflux or GERD, it's possible that those symptoms are going to be worse when you're on your period. Anyone who suffers with this knows that it can really wreak havoc on your voice when you have a bit of acid reflux going on. I always seem to have a few weeks of acid reflux going on whenever I'm in a production where I need to wear a corset, especially eating and then putting a corset on and then singing. Try and avoid that if you can. It's not good. If you have GERD in particular, but any type of acid reflux, go to your doctor and see what lifestyle factors you can incorporate. And then if you need to go on medication, you can talk to them if you need to go on medication for your reflux. You may also find during the time that you're menstruating that your voice will get tired more quickly than usual. As I mentioned, you might have more difficulty singing high notes than usual. Again, think about what happens when you're singing a high note. You've got your vocal folds kind of stretching and slimming down, and if they're kind of thick and they're have swelling on them, that process is obviously going to be a little bit more tricky. The color of your voice might change a little bit as well. It may feel husky or breathy. With a lot of the fluid retention that's going on in the body, some singers report feelings of having like a stuffy nose. And if you've ever needed to sing before when you have a bit of a stuffy nose, you know that all the sensations that you're used to when you're singing, when you're totally healthy, it feels quite different. So especially where you're feeling the resonance happening in your head is going to feel different when you have fluid retention. You've got a bit of a stuffy nose happening. So you may perceive that perhaps you have a loss of resonance happening. I mentioned also you might feel your voice is a little bit sluggish. It's lacking agility. You may have some issues controlling your pitch. You may feel you have a bit of a thicker layer of mucus on your vocal folds, so kind of feeling that you need to clear your throat or little kind of gloopy when you're trying to sing. The other thing as well, shifting dynamics may be a little bit trickier when you're singing on your period as well, particularly singing soft. So when everything is feeling more effortful, you may just feel like you need to kind of push your voice to make a sound, and really forte is kind of your only option, and anything more refined and piano is really tricky. So now we know what we may be dealing with. Is it okay to still sing on your period? Did they have the right idea a few hundred years ago when they were just like, hey, like chill out, don't worry about the performance? So my answer is you can sing, you just have to be mindful of a few things. So number one, you know how I mentioned that the capillaries in your vocal folds are going to be slightly enlarged. When the capillaries are a little bit enlarged and you're still using your voice, you are at a slightly elevated chance of having a vocal hemorrhage, so a vocal injury. On top of that, you know, it's very normal that people who menstruate may have pain at this time of the month as well, with cramping and stuff like that. Be careful taking anti-inflammatory medication, and especially things like aspirin. So these have a blood thinning effect. It's going to be more difficult for your blood to coagulate. So that's another element that could put you at greater risk of having a vocal hemorrhage as well. So try and avoid those medications. Now, when singing feels more effortful, it's a very natural reaction to just try and push the hell out of our voice. I don't really need to tell you that that's not a good idea. If you do need to sing when on your period, there are a few things you can do to make things a bit easier for yourself. Take your time warming up nice and slowly. You know, typically you never want to warm up more than 5, 10, max 15 minutes, but really just spend the time coming from almost zero. So semi-occluded vocal tract exercises are really great for this. Start with ones that are a little bit lower pressure than some of the others. So Straw singing, fabulous. So either you can sing directly through a straw or straw in some water, make some bubbles through the straw. Really fantastic to just start warming things up. Then you can move on to something like nasalized consonants, so things like doing little very gentle sirens, like this. And then once you've kind of warmed into that a little bit, then you can move into semi-occluded vocal tract exercises that are a little bit higher pressure. So things like lip trills, or rolled R's, or you could do things like ones that are fricatives, so like or zzz. And throughout this whole process of warming up nice and gently, just keep checking in with your voice. If anything hurts, stop. Where you can, try and scale back on any heavy vocal demands that you have. That doesn't just include singing. It also includes kind of loud social engagements as well. So that could mean, you know, talking on the phone for hours, but it could also mean, not right now at the time of this video, but hopefully in future when you are allowed to go out to restaurants and bars and things like that, where those environments can get quite noisy and you don't realize that you're yelling to be heard. These are all things that are going to fatigue your voice, and if things are already swollen and a bit unhappy, it's just going to make things worse. If you are singing on your period, this is the time to use your technique. You know, this goes beyond just saying like, don't push. You need to be 100% on your support. You really need to have nice release breath, nice clean onsets. Anything that you can do that is going to make your voice as efficient as possible so you're not wearing yourself out. So if you're a beginner singer or a younger singer and you're still kind of trying to figure out your technique, do be a little bit more careful, knowing that these things take time to build, taking into account that you are at a point in your cycle where things may be a little bit harder to navigate than usual, and also there's a slightly higher possibility that you could get injured. So I really recommend working with a vocal teacher so you can build your technique. And if you're interested in working with me, you can find my details for one-on-one tuition in the description. During this time, you can feel your body telling you to rest, and it's a time where self-care is really important. So just managing your stress in general is going to be wonderful for you right now. You can do gentle exercises like stretching, yoga, maybe a gentle walk if you're up to it, but really just listen to your body. So I'm obviously not a doctor, this isn't medical advice, but if you really feel that your hormones are playing absolute havoc on your voice during the time that you're menstruating, do consider going and having a chat to your doctor about perhaps going on the contraceptive pill to just help level everything out. But obviously that's a discussion between you and your physician. So let me know down below, if you're someone who's a singer and you menstruate, did you know that there was a link between hormones and the voice? Or is this kind of a light bulb moment for you, like, oh, it all makes sense all of a sudden? And have you got any favorite self-care activities that you like to do when you're on your period? Let me know in the comments below. Thanks for hanging out with me. I wish you a wonderful week and I will see you next Monday. Bye.